Okay, well, I'm really excited to get started. Let me just... Oh, yes, please do introduce me. Thank you.
Hi, everyone. I'm Caroline. I'm with the American Brain Tumor Association. I'm a volunteer, and I'm stepping in because our introducer was not here, so I apologize for reading. We're very excited to welcome Dr. Abigail Levinson Marks to our talk today and to our breakout room. Dr. Marks is a clinical psychologist. She's based in San Francisco. She treats children, adolescents, and adults with a focus on helping families through illness and loss. Dr. Marks is also the founder and camp director for Milton Marks Family Camp, and this was founded in 2014 in collaboration with the Neuro-Oncology Department at the University of California, San Francisco. I'm in LA. This annual 3-day camp is for families coping with a parent's brain tumor. Dr. Marks' husband, Milton, sadly passed away in 2012 from glioblastoma. Welcome, Dr. Marks. We're excited for our conversation today.
Hi, thank you. And it's great to see all of you here, and I know a number of you will be watching this from the recording as well, so welcome to you too. So as you just heard, I have a number of ways that I kind of approach or understand the experience of parenting with a brain tumor. The first, of course, is that I was a parent in a family with a brain tumor. My husband, Milton, died in 2012 after about 20 months with glioblastoma when our 3 kids were very small. I'm also a clinical psychologist, and even before he was ill, part of my work was with family illness and bereavement, and as you can imagine, I've continued that now. And so not only do I have my own experience, but I work a lot with families dealing with this, and then, as was just mentioned, I run this family camp, so I know a lot of families struggling with this, so that's kind of my own experience that I'm speaking from. No disclosures. Okay, so I'd like to start with just a description of what it's like. I mean, if you're all here, you all know what it's like. But it's good to name things and start on the same page. So this is the page I'd like to start with. You probably can't read the text. It's a page from the most beautiful graphic novel called Last Things by Marissa Moss. I highly recommend it. It's actually about her time with her husband when he was diagnosed with ALS. So not a brain tumor, but the version of ALS that he had is actually kind of similar. And this, I love this page. It's one of the first pages, and maybe even the first page of this novel, where they're on a vacation in Italy with their kids. Actually, I think it's a sabbatical year, and then all of the sudden, symptoms of ALS start. And I love that last illustration because I think it's really evocative of something. You know, a brain tumor diagnosis can feel just like this. You're living your good life, or even you're not always good life, and then this happens. In this case, you know, and a boulder comes out of nowhere, and in this case, it comes right between the two of them. So, again, just going over things you probably already are very aware of. What's challenging about being a parent with a brain tumor? And I just want to say here, when I say being a parent with a brain tumor, I'm talking about both patients and caregivers, because you're both parents in families where there is a brain tumor. So what's not challenging about parenting in a family with a brain tumor? First, you have the stresses of quote-unquote normal parenting. You know, the meals, the carpools, the homework, the moody kids, the bedtimes, challenging schedules. You're likely already overstressed at baseline, and then this happens. So there's the kind of logistics, stresses of the tumor, medical and other appointments, financial stress, fear of the future, and that's not just of the long-term future, but sometimes the future is unknown even like that afternoon or the next day. The roller coaster that you're on, not knowing what to expect. Plus, you and the kids are dealing with the fallout of the emotional fallout of the tumor. Thank you. Hold on one second. where both parents may be less available to your kids just because of what else you're dealing with. The kids may be acting out clearly in distress or just also not at their best, which makes it harder to parent them. The patient's symptoms can sometimes make parenting more challenging. And as you know, and as was talked about really beautifully in the keynote yesterday, sometimes having a brain tumor means changing roles between spouses and changing roles with your kids. So what I'm going to talk about today is how do you adapt to this new reality and thrive with it? And specifically, I'm going to spend a bunch of time talking about how do you find ways of talking about this together, staying transparent, and also how do you know when your kids may need additional help beyond just the help they're going to need, the help every child is going to need when a parent has a serious illness. So why is it hard to talk with your kids? And I think it is hard. I mean, I found this hard, and I'd already been working in the field. It's so hard to talk with your kids about something that you, more than anything, wish did not exist. Because when you talk with your kids, you kind of have to own the reality of it. I think sometimes there's a feeling that if you shield your kids from the enormity of the brain tumor, it can feel like you're actually able to protect them from a reality that's really heartbreaking. And then there's the feeling that we all have, I think sometimes, that saying something makes it real. It's kind of a shoot the messenger feeling, a worry that telling them will bring about a trauma, almost as if the trauma of the illness is being delivered by you, which is an awful feeling as a parent. And I think also, thinking about talking about something so hard, you're aware, even if it's only in the back of your mind, that you're going to be having to witness and hold your child's really difficult emotional response. So I also think part of it is, we don't necessarily have the tools to know and the words even to know how we can talk about something like this without it being traumatizing. So part of what I'm going to do is I'm going to give a lot of examples. They're not like, this is exactly what you say examples. This is the first thing that occurred to me when I was writing this up, just to kind of model a certain way of using language. And what I'd really love is if in the question, I've left a little extra time, I hope, for the question and answer period. And if you have anything you'd like, anything hard that feels impossible to say that you'd like me to wordsmith a little, I love doing that. Okay. Why is it important to talk with your kids about what's going on? Can you all hear me, by the way? Okay. Why is it important to talk with your kids? Well, kids know something's up, usually. I mean, it could be because they've overheard phone calls or conversations. Kids do that. But it also just could be because kids are like little sponges. They soak everything up in their environment. And even if they can't say that they know, part of them, part of their sensors are always picking up what's different, what feels tense. They just unconsciously gather clues from the world around them, and they know. So the other thing is, when you don't talk about something that your child knows, it can feel like there's a taboo. The message that they can get is, this is something that can't be talked about. And kids wonder why. And sometimes in their minds, it means because if I talk about this, something really awful is going to happen, or this is such a dangerous, scary thing that it just can't be said. And I have to keep what I'm thinking and feeling from everyone, and that can feel really isolating for kids as well. The other thing is, in the face of not knowing, kids will just naturally, developmentally make up a story, because being in a state of confusion is really hard. It's a hard feeling for us adults. It's even harder, I think, for kids to stay with that. So kids will find their own reasons why they're noticing the things they're noticing, and some of this will surprise you. I'm just going to give you an example from my own life. So like many people, my husband was diagnosed with a glioblastoma when he had a really huge seizure. This was in the morning before we got the kids ready for school. So there were ambulances and fire trucks, and a neighbor actually rushed over to like watch my kids while this was happening, and he got carried out on a stretcher. And it was only months later, and completely coincidentally, that I found out that one of my 4-year-olds thought having a brain tumor meant that there was something wrong with your mouth. And I didn't understand that until we talked about it, and it became clear that when he'd seen his dad being carried out on the stretcher, because of the seizure, he'd bitten his lip or bitten his tongue, and there was blood. So all this time, he'd been making up a story about the mouth, and that's what was going on, and he'd been worrying about his own mouth and watching other people's mouths to make sure they were okay, and we just never would have known this if casually he hadn't mentioned it. So that's just a normal way. Kids will make up stories if there's something that they're not understanding. So open conversations convey, this isn't too scary to talk about. This is not going to break apart our family. Also, it conveys to kids that they're not alone in this, that you can all talk about it together and plan and answer questions. It conveys that they're important enough to be one of the people who know. And it also gives you an opportunity to like with my son, you can understand what's going on in their internal world. What are they thinking? What are they feeling about this? And then you can help them with it. And it also just shows questions aren't threatening. We'll always be there to answer what you're interested in knowing about, what's making you worried. Okay, so if you're going to have a conversation, and I'm imagining a lot of you have had these conversations, what to consider before you begin. Obviously, the ages of your kids. I think, we always say, like, aim any conversation to the age your children are, as if that's a hard thing to do, when I think as parents, we just kind of naturally know what kind of language our kids will, and ideas our kids will be able to understand. But I am going to talk about a little bit about kids at different ages and what's going on, and what is hard about having a parent who's ill. So it's important to be honest and be transparent, but also, of course, gauge how much or how little they want to know. You want to always follow their lead and have a conversation that is not just about telling, but also about listening. But the most important thing here, I think, is that the tone of the conversation should communicate, we can talk about this. It's not taboo. You can ask us anything. Anything you're thinking or feeling is not dangerous to talk about. The other thing that's important is just to follow up. That this is not usually talking about this is not just a one and done. You're going to want to talk to them at bedtime. How was it when we talked about that earlier? Do you have any more questions, or was there anything that's scary? Or just, days later, or just be listening for things that might indicate that they're worrying about something, confused about something. So how do you start conversations? So like I said, I like to think about listening first, and connecting with wherever your child is. And what I usually do is suggest that you start with what they've noticed. It's an easy intro to a conversation. It also makes it, I think, easier for us as parents, because it's really hard to know how to segue, how to actually start that kind of conversation. You can say, for example, I know you've noticed that Daddy is more tired lately and sleeping a lot. Or remember how Mama was in the hospital last week? Or how Daddy's losing his hair? Things that that they noticed, as a way of kind of putting yourselves and them in the same spot of their experience. You're starting with their reality that they live in. You're letting them know you're going to explain the reason for something they may have wondered about. And then if they can, you want to let them tell you about their experience if they want to. A lot of kids absolutely do not want to go there, and that is totally fine. But they may really open up to you. You can ask kids what they've been imagining. And if they tell you something that they've been imagining that isn't correct, I like to wait a little bit before correcting it. So you can get and let them know that you understand what they've been thinking or feeling or worrying about before then saying, actually, this is the reality. So I'm going to give you, again, some more examples. When you noticed that, what did you think was happening to make mama tired, for example? Or did you have an idea about why daddy couldn't talk all of a sudden? Or if they tell you about something that they're thinking and imagining that's really scary and not true, you can say, or even if it is true, you can say, it seems like you've really been worrying about whatever thing it is. That must be really scary, or that must have been really scary. So just a way of feeling close to your child. So then you want to name it and explain it. And generally you want to do these in really little bite-sized pieces so that they can have time to take it in, and also so they can have time to just let you know they are not wanting to talk about this anymore, which is fine. You may start talking and they may just zone out, or they may change the subject, or they may even leave the room. And all of that is fine because there's plenty of time to come back to it. They're just letting you know, I need to know this much, but I don't want to know more. So again, these examples are not perfect. Oh, I wrote them up there too. Mommy has something called a brain tumor. Sometimes cells, which are little tiny parts that make up her brain. Obviously, they're very little. You're going to want to put it in a different language, or explain what cells are, or explain where a brain is and what a brain does. Started growing differently and really fast, and we don't know why. Then you leave a big pause. They're taking up space in her brain, and the doctors need to take them out. Mommy's going into the hospital on Wednesday to have a surgery, and then you can explain more and more, but always kind of pausing and waiting to see, is that too much? Or if they have any questions at that point, like what's most urgently in their mind. Or when a brain tumor is taken out with surgery, sometimes these little tiny pieces are left behind, and the doctors can't even see them when they're doing the surgery. They're too tiny to see. But we want to make sure that those little tiny pieces don't grow again into another tumor. So the doctor's going to give daddy this medicine to kill them. And the medicine's called whatever, chemotherapy, radiation, we call it chemo. This is what's going to happen. A lot of times the first things that kids will wonder about in any given conversation, diagnosis, recurrence, any new symptoms the brain tumor patient is having, they are first going to think, how is this going to affect me? How is this going to affect my life? So I always try to put that in conversations. So, for example, even if it's just something like, when people get radiation to kill the tumor, sometimes things taste or smell different for a little while. So mommy might not like the smells of some things at dinner. You're preparing them for, this is how it's going to enter our lives as a family. Or daddy isn't going to pick you up from school this week. He might be really tired after the medicine. Grandma's going to pick you up instead, and then you're going to go do this. So when to have ongoing conversations? And again, most of you know this, that if anything's changing, the patient's health, new treatments, even, you're moving in with grandparents, changes in the kids' lives, one of you is stopping working or working less, you want to see if you can reopen a conversation just to let them know. Because again, they've noticed, they're observing, they may be worrying. So I just wanted to talk about some of the harder things, or usual things that might not be obvious, or are obvious and are really hard to talk about. So what do you do if they have the idea that they might get sick too? Actually, this was also covered in the lovely keynote yesterday, because this happens, especially preschoolers and young school-age kids may worry about this and have something called symptom mirroring, which is when if you're having a headache, they're having a headache, or you're having a stomach ache from treatment, or food doesn't appeal to you and suddenly they're having a tummy ache too. It's just their way of kind of working through what this might mean and what it might feel like. But then there's the question, can they catch it? Can they have a brain tumor too? So you could say something like a brain tumor or brain cancer, it's not like when you're sick with a cold or with COVID or the stomach flu. It's not contagious. That means you can't catch it. And we don't know how you get it, but we do know you can't get it from other people. What if they worry they may have caused the cancer or might be making it worse? Now, this is a thing you sometimes will hear from kids, but a lot of times you won't hear it, but they'll be wondering and thinking about it. Especially teenagers tend to worry about this, but younger kids too. You know how I talked earlier about how we make up stories when we're confused, when things feel inexplicable, don't make sense, and things that are completely out of our control. If things are happening that are completely out of our control, it can help to feel like there's reasons in our control why they're happening. And for kids, honestly, for everyone really, when something traumatic happens, this often means the feeling that they may have caused the cancer or maybe making it worse somehow, maybe by something bad they did or by yelling at the parent, or they have all sorts of fantasies about that. One way to help is if they ever do bring this up or you find out about it, you can listen to them. You can, again, like I said, empathize and connect with them about how they're feeling and how hard that must have been. And then you can let them know scientifically, how that's not true or how it doesn't work or how feelings don't make things work. And also how this is really normal, and a lot of kids whose parents are sick worry about this. But another way to help is by help kind of with the feeling in general, and I'll talk a lot more about this in a few minutes, to help with the feeling of being out of control in general. One way is by finding things that your kids can do that will help, or things that your kids can do that are kind of a force for good. And that can be just like making the brain tumor patient a sandwich that they like, or sitting with them, or writing them a card or drawing them a picture, watching a favorite show together, and then really emphasizing how much their parent, or how much you, if you're the parent with a brain tumor, is loving that and how much it helps them feel better in that moment. Obviously, they can't, you can't, no one can do anything to take away the diagnosis or the prognosis, but there are those little things you can do to help, and it's really important. I'll talk a lot more about this later. Other frequent and normal concerns: how will their life change now? Feeling alone, explaining symptoms that are really hard to explain. I want to spend a little bit of time on this because it's something we don't usually talk about. And it's often really tempting to not talk about the most confusing parts of having a brain tumor with kids. How do you explain why daddy gets more angry now, or mama can't speak sometimes? And obviously, if you have a lower grade tumor or you don't have symptoms like this, you're not going to run across it. But I think in families where there have been really significant effects of the tumor or of treatments like anti-seizure medications, sometimes those are conversations you need to have. So I'm just going to, before I give you some examples, I want to say, one reason I think this is that it's hard to have these conversations is that there's so much unnecessary shame out there about brain tumors as symptoms, as if we had control over them somehow. And I think it feels like putting words to them will somehow be shaming or humiliating for you to say, or scary. But I just want to give you some little examples about how to talk about things like that in a non-scary, non-shaming way. So I'm going to go for some of the hardest things. And like I said in the Q&A, I would love to hear about anything else you're finding a hard time putting into words. So, for example, first, somebody has aphasia. You could say, you know how sometimes mommy can't say some words? That's because of the tumor. And this is obviously for a younger child. When we talk, it's not only with our mouths, but actually our brains help us talk too. There's a part of our brains that lets us think in words, one part that lets us understand what people are saying, and another part that helps us put into words what we're thinking or are feeling. And mama can understand everything you're saying because there's no tumor in the part of her brain. That works fine. But the tumor's in the part which makes words. So sometimes that stops that from working right, and it's hard for her to speak. Or, and this is, I think, one of the hardest things for families in my experience to talk about. This is for a slightly older kid. I want to talk with you about what happened after dinner tonight when Daddy yelled at you when you were putting things in the dishwasher. You know how Daddy's been yelling more than he used to, and it's kind of louder and it feels scary? It's actually because of the brain tumor, or it's actually because of the medicine he's taking for seizures. It's hard to understand, but there's parts of the brain, usually these parts here in the front, which is where your daddy's tumor is, that help us calm down and be even-keeled, even when we're upset. That's the part of the brain that actually little kids don't have, or little kids don't have a lot of it, and it grows as you get older. That's why, some very little kids have a hard time when they have big feelings, and if they know toddlers in their lives, you can give some examples. And as always, this is going to be in bite-sized pieces. So the brain tumor that Daddy has is in that part of the brain, which means when something even a little bit annoying happens, it can feel really big and like a disaster to him and like it needs to be fixed right then. So you were loading the dishes fine just now, like I told you when we were out there. But something small probably irritated him, and his brain wasn't able to stop him from exploding at you. And that kind of yelling is something parents try not to do when they don't have brain tumors. And I know Daddy really, really would not want to have you feel the way you're feeling right now. Because it can make you feel like you did something bad when you didn't. Did it make you feel that way? You can go on and you can say, and also they can make you feel like Daddy is mad at you and I know that this is really confusing. What's going on inside his mind is that he's trying to help you learn something because he loves you. It doesn't come out that way, and it's not okay that it doesn't come out that way. So let's talk about what we can do to help you and your sister when that happens, and here's things we can plan. That's just one example of kind of, I guess what I want to get across is it's possible to talk about those kinds of hard things in ways that are not shaming. Okay, the other hard, or maybe the hardest thing, are the questions about, are you, the ill parent, going to die? And when to talk about death. Feel free to zone out or kind of go la la la. If you don't want to think about this right now, that's fine. You play on your phone for a minute. This is really a much longer conversation, but in brief, I think obviously this is the question parents most dread. We don't want to talk about this for very obvious reasons. We don't want it to be true. But it doesn't have to be as scary as you think. A lot of this depends on the child's age, of course. If you have young adults or older teenagers, you can ask them, what and how much do you want to? Do you really want to know this? Do you want to have a conversation about it? Are you asking because you're scared? You can let them lead you because they can tolerate that, and also because the internet exists. And older kids can easily search things up. I always think of this example. I had a family that I was working with, 2 moms and a 11-year-old boy, not with a brain tumor, with another kind of cancer. And they were asking how to talk to him, really feeling like they didn't want to, burst his bubble. He was doing great. And then I talked alone to the son, and he'd known for like a year what one of the mom's prognosis was, because he had researched on the internet and gone down all sorts of rabbit holes, but his feeling was, they want me to not know because they want me to be happy, so I need to protect them from that. Obviously, not every 11-year-old's going to do that because not every 11-year-old wants to know. But with younger kids, you can tell them bits of the honest truth, always making sure to leave room for the hope that they want to have. I think that's really, really important. Kids have really strong emotional defenses. And they make use of a lot of defenses that in adults would seem extreme, like complete denial, which is fine with kids. Or complete just kind of escape from reality. If they don't want to think of something, they're not going to think about it. So I think that giving them kind of a way out if they don't want to believe that someday you may die from the tumor is always a good idea, but also being honest so that they can kind of, part of their mind can know something and part of it doesn't, or they don't feel taken by surprise later if the worst happens. So some examples. One example, if a kid says, "Are you going to die from this?" If you think they're just scared, you can just say that. You can say, "It sounds like you're really worried I might die from this." And that might be the conversation they want to have about their worry, about what they think, about how it's scary for them, about how much they love you. And you can just leave it there if they're not still curious. That makes them feel not alone with their feelings. Or you can say something like, or I wouldn't say it like, but yes, some people do die from brain tumors. But the doctors are going to do everything possible, and so are we, to treat it, and you can talk about the treatments. Another thing you can talk about, for example, if you have a lower grade tumor and you think one of these new treatments might come that will mean you don't have to die from it, as a way out for your kids, you can say, this is a slow-growing tumor, and after whatever treatment you're getting, it could go away, maybe for a long time. Or you could even say, maybe it'll go away forever. And if and when things change, your kids will notice. Then it's time to revisit it. If you're still getting treatment, but you want it, but it's not going well, you know you're going to have to stop soon, and you want to kind of give your kids a heads up that something's going on, you could say, "I'm still taking the medicine," or if you're a caregiver, you could say, "Daddy's still taking the medicine to fight the tumor, but a lot of people do die from brain cancer. The doctors are doing everything they can so that Daddy can fight the cancer as long as possible." You're still leaving room for hope, but also slowly introducing death as more of a possibility. And if you've stopped treatment or you're at the end of life or hospice care, then you want to be more direct, because it's important to prepare your kids from this and not feel like you've hidden something from them. And how early you do this will depend a lot on how old your child is and how long they can handle knowing this. And of course, sometimes we don't know what our prognosis is. A month, a couple weeks. And some words people use for this are things like, "Mommy's going to die. We don't know exactly when, but it could be soon, like it even could be sometime this summer. This is how we're going to help her. And this is what we're going to do as a family." You can talk about making smoothies, or you're going to go on a trip, or, this is how we're spending time together. And you can also reassure them, she is not going to die today or tomorrow. We'll know it's getting closer by, and you can talk about things like, she won't be getting out of bed, or she's going to stop eating or stop drinking. They'll mostly only hear what they can tolerate knowing. Okay, that was a really, really tough part of this talk. And I'm going to just move on to talking about how we can adapt and how we can thrive. So the first thing I just want to talk a little bit about, obviously there's a lot of different things to say, and I'm actually going to breeze through this because I want to leave time for questions. So different ages and normal reactions they may have. Babies notice because they notice things have changed with you. Toddlers notice because they notice things have changed in the routine, but it's really hard to talk to them. There's actually a really, really lovely way of talking with toddlers, which I don't have time to talk about now, but I'm happy to talk about in the Q&A, or if you want to reach out to me later, or those of you that are watching this on a recording want to email me, I'm happy to go over that, and it kind of involves puppet shows and having a puppet show and then letting them redo the puppet show about what's going on. Preschoolers, as I mentioned, a lot of symptom mirroring. You're nauseous, they're nauseous. And they have, a lot of times, especially age 4, age 5, they really need a lot of control. They're going to be more independent, which also means they are going to react more. And school-age kids are really going to react to not having control over certain things, not having control about the fact that you're sleeping and they want you to be awake, or they want to play with you and they can't, or you can't do X or you can't do Y. And that can be hard, and there can be more meltdowns, more tantrums. Like I said, it's not just that you have the parenting challenges of parenting whatever, age your kids are. That's going to be harder because they're going to also be feeling it. And I just wanted to say it's really exhausting to parent young kids. So just wanted to throw that in there. School-age kids, a lot of times will feel embarrassed, especially if there's something about your appearance, the way you're walking or talking or having an Optune or, they can feel really embarrassed if there's something their friends might notice. And a lot of times they can feel really understandably envious of their friends' lives without an ill parent. And that's such a tricky feeling because it can make them feel more isolated. And they can also be, again, really justifyingly angry. Teenagers, one important thing to know about teenagers is, of course, they're trying to separate from you. They're trying to form their own identity. And a lot of times that means rejecting, especially with the same sex, the same gender parent. That means rejecting a lot of things about you. And it's really important to be able to notice that and not withdraw from them or not, penalize them for that normal kind of rejection, especially when you're trying to be closer as a family. That can really lead to guilt, which I don't have time to talk about it much now, but I think, just like I said before, kids can feel really guilty. What else can you do to help? You can maintain closeness in your family by doubling down on what you can do together. As I said before, being open to conversations, making use of helpers. I'll talk more about that in a minute, but I just want to say, I know it's really hard to ask for help. One thing I've found people do that's really helpful is maybe recruit one friend that can actually talk to you about what your needs are and then go out and ask for help from other friends. And if you can afford it, this is a really good time to hire help, cleaning your house, meal prepping, driving kids to after-school activities, maybe even like a meal prep subscription. Investing time and energy in helping your kids be independent and knowing you'll be okay with it, getting more trusted sitters, signing them up for activities, letting them know that's okay with you, and letting them stay close to you when they want to. For adolescents, as I mentioned, encouraging them to pitch in. There's a lot of research, interestingly, on chores being really helpful in families where a parent has cancer because it makes the kids feel like they're contributing to the family. And they're a force for good. So how do you cultivate agency when your kids are feeling a lack of control? Obviously, there's so much you can't control. The efficacy of treatments, your symptoms, progression, time that you have left. One of my cousins, before my husband was sick, had a child who's fine now, but had a pediatric cancer. And she said what she got her through it and what got me through it was kind of this mantra, I'm not in control, I'm not in control, which you'd think would be like the worst thing to feel, but in a way it can be really liberating because you can choose to be kind, you can choose to do things for each other and to help your kids do things for each other. And you can choose to absolutely define your priorities of what's important to you as a family and then do those things. So when to seek additional help? You probably know this already. You want to listen to your parenting gut, but anytime your kid has notable and not temporary changes in sleep, eating or appetite, nightmares, physical symptoms, or just a lot of acting out, not just the occasional meltdown, but a lot of resistance things they used to like or love, worse temper tantrums or substance abuse, alcohol use in kids, anxiety that can't be soothed, unusual risk-taking, which is, jumping off things that are clearly too high or running into traffic in littler ones, late nights out past curfew, older ones. Obviously, a few of these is fine, but a pattern is more worrisome. Slipping grades, skipping school. What do you want? What kind of help do you want to seek? Well, you want to get help for yourself, obviously. That can be seeing a therapist, a pastor, getting community support, and looking for support from your child's school community, teacher, school counselor, pediatrician, child life, anything, a child psychologist. a therapist, highly recommended. Anything really that is in your circle of connections, whether that's through where you're being treated or through other people that you have, getting to an expert's often really, really important. The other thing I want to say is there are things that can support every kid, not just kids with red flags. You may have support groups for kids in your local area. There's also groups like Pickles here in Chicago. Camp Kesem, which is, if any of you don't know about it, please ask me about it. It's a week-long sleepaway camp for kids, which is super fun. They love it, with amazing counselors run by different universities. Bright Spot Network, which if you have kids under 7, they're amazing. They offer online support groups. They'll send you boxes of like toys for kids and boxes of books for them. I actually have lists right here. I've got a couple of them of recommended books that they that for kids, and also picture books to help your kids understand. That's it. And now I am ready for questions.
If anyone, there we go. I'm going to come right around to you with the microphone.
I had my hand up first.
Oh, I didn't know.
I'm just kidding. I'm just kidding. I just wanted to reaffirm what you just said about Camp Kesem. Our children went to Kesem, and the 2 youngest ones, the oldest ones is 24, so he couldn't go to camp. But we knew that one of them, who was very outgoing, that she would like it. But one of them we really didn't think would like it, and he ended up loving it and couldn't wait to go again the next year. I just wanted to reaffirm that.
I had to bribe my kids with a gaming system to get them to go to Kesem the first time, because I knew how they would love it, and they loved it. So, I mean, anything you can do to get your kids to go, it's so fun.
So I've got twin 12-year-old boys at home. They're going to be 13 in January. They were 6 when I was diagnosed with glioblastoma.
Yeah.
And they have loved Camp Kesem. It's because I come to these things because you don't really get it unless you've got it too. And so they're able to talk to kids who are going through the same thing they're going through, and just the peer support. So.
Yeah. Just being around. They don't do a lot of talking at that camp. They do one really kind of meaningful evening ritual, but a lot of it is just having fun with other kids who get it and counselors who get it. There was a question online that I'd like to answer. I have it, I wrote it down because I thought it was a great question. This person asked, letting go of guilt. I hold so much guilt for the sporting and school events I missed and continue to miss, for not showing up when the kids show up for me, and how do we as patients and parents let go of the guilt? I don't know if the person's here or virtual, because I wanted to ask, I'm not sure what they meant about showing up when the kids show up for them, but I mean, I can imagine maybe that means your kids want you to be with them, and yet you can't. Either you're the patient, you might be too tired, or you're the caregiver and you just have so many things you're doing, you have to make choices. And I just wanted to take a little bit of time to answer this because I think it's really resonant with a lot of us. I think it's, again, one of those examples of you're not choosing and you don't want the reality that you have. It's a loss. I mean, it's a loss not being able to do things and give your kids the reality that you've always wanted for them, the life that you've always wanted for them without this worry. Being a parent is, even in the best case scenario, kind of a gradual process of coping with loss, whether that's, you get to be with a newborn, anything they need, anything they want, you want to give it to them. And then at a certain point, you have to sleep train, maybe, and say no to your kid, or your toddler's wanting to cut, their sandwich with a really sharp knife, and you have to say no. There's a way that, even though we might want to always make our kids happy, we can't. And gradually sometimes we realize we can't even be the parent we wanted to be all of the time. Those are just normal losses, I think, in parenting, of control. We all want to make a perfect world for our children, and sometimes we think it can be possible, but it never really is. But when you have a brain tumor, or you are living, or your spouse has a brain tumor, it's not just in the normal developmental process of being a parent to growing kids. It's a really significant loss. And I think when something like this happens, you're forced to make really impossible choices, and most of them aren't actually choices. You don't have a real choice whether or not you're showing up to your kids. You're setting priorities, and sometimes they'll lose out. And sometimes you just can't. I think in a way there is this illusion of having choice, and so we feel guilty for things. And sometimes that's even because I kind of explain this in a little way with kids. But, as adults, I think it's sometimes easier to feel guilty about the things that we can't give, that we feel like our kids should have, than to feel the kind of anger and rage that this has happened to us and to our family and we can't control it. So it's just really unfair. It's really unjust. So I'm not sure if this helps in relation to letting go of the guilt, but I think sometimes when we can kind of sit with our feelings a little bit and feel, if there is anger there, and there often is, to just know that, you're not in control and you're doing the absolute best you can. You can't be everything to everybody all of the time, and that really sucks. So, any other questions? Oh.
My first diagnosis was before I ever met my husband or had kids. But then when my son was born, I had reoccurrences, and he's grown up with me being sick.
Yeah.
And then, he knows I'm sick. He knows I go get pictures of my head taken.
Yeah.
And then he's good with that. But he's also autistic with ADHD.
Yeah.
And so that's a developmental setback for him. So he's 10 years old, and he thinks more like a 7-year-old.
Mm-hmm.
So when he's getting angry and anxious now, I don't know what that is. Like, he's getting very upset in school, and I'm like, what are you doing? I don't know how to help him.
Yeah, that's really complicated. I do want to put in a plug. Bright Spot Network has a lot of resources for talking or helping your kids who are on the spectrum or in any way neurodivergent. And they're actually having, I think, a workshop next month about it. So check out their website. I can give that to you later. It's so tricky. I think that's a big question, which is like, when something's happening with your child, how do you know what it is? Maybe it's not even about your illness, right? Maybe it's something else that's happening in their lives. I think, really, like with anything, if you're noticing that your kid's having a consistently harder time, that is the time to reach out for help and somebody else to help you think this through. Which is impossible for me to do with you now, but I'm happy to stay for a couple minutes and help you think about it. But really, like, what's going on? Have there been other changes? How to understand if this is kind of his way of understanding more about what's happening to you, and then to have conversations about it. Just kind of the same way that I was discussing earlier, seeing if you have a way and language, maybe while you're doing something active, playing or, carrying in groceries or anything that's feeding him in a sensory way, that you can actually say, I don't know if you've noticed changes, or what do you think about this, or, but generally I think that's going to be part of kind of a bigger assessment of what's happening with the people who are already in your lives helping, or new people.